They just called a code blue in the cardiac cath lab. It sucks to be them.
Nurse Blunt, are you in charge right now?
Yes, doctor, I am the charge nurse for the cardiothoracic intensive care unit.
I want you to grab a bleeder tray and follow me to the cath lab. A patient down there just coded and I need to crack her chest.
Sheet.
Nurse, this is a 68-year-old woman who has no history of medical problems or surgery.
No offense, doctor, but when I walked into the room I could see she had a surgical history. No 68-year-old woman has tips that point up to the sky like hers unless they were surgically implanted.
Nurse Blunt, please hand me the scalpel.
The patient remains asystolic at this time of incision. Doctor, the patient's cardiologist wants you to stop. He says he knew this patient very well and that she knew her risk of this procedure. He says she would not have wanted to be cracked wide open.
Whatever.
Doctor, before you leave you need to sew her chest back up. I will assist.
Nurse Blunt? What are you doing?
I have always heard that women with breast augmentation have really hard boobs. When would I ever get to feel a boob job? I figure she doesn't care if someone grabs her boob now that she's dead. Yep, they are hard as rocks. Are you finished, doctor?
Yes. Thank you, Nurse Blunt.
Doctor, wait. She has a really strong pulse.
Hook her back up to the monitor. She is in a slow ventricular rhythm, but she has not received any oxygen in about 10 minutes. Her brain is dead. It's just the epi that has now reached her heart. I know this is hard, but she has been pronounced dead. You need to turn off the monitor and let her go.
With all due respect, doctor, fuck that. Less than 72 hours later, the patient was walking in the halls.
It was all because the nurse grabbed this woman's tits.